Hey guys, this is Dr. Hub. Whether you're in medicine, from specialty to super specialty, allied sciences, or simply curious, this focus content it delivers the key points you need to know. Let's look at the arteries which supply the cranial fossa. So first is the anterior cranial fossa, ACF. So the arteries involved here are the anterior meningeal. In case you haven't subscribed, please do subscribe and grow daily. Meningeal branches. This is of the anterior and the posterior. Ethmoidal arteries. Next will be the meningeal branches. Next is the meningeal branches of the internal carotid arteries. And next is the branch of the middle meningeal arteries. Next is the branch of the middle meningeal arteries. So anterior cranial fossa, anterior meningeal arteries are branches of the anterior and posterior ethmoidal arteries. Next was the meningeal branches of the internal carotid artery and the branch of the middle meningeal artery. Now let's look at the middle cranial fossa. So under the middle cranial fossa, it includes the middle and the accessory meningeal branches. So there is middle and the accessory meningeal branches. And this is nothing but of the maxillary artery. This is of the maxillary artery and also a branch of the ascending pharyngeal artery. So it's also a branch of the ascending pharyngeal. To recap the middle cranial fossa, there is a middle and accessory meningeal branches of the maxillary artery. Next comes the ascending pharyngeal artery. Next is the branches of the ICA, that is the internal carotid artery. Then comes the recurrent branch. So this is the recurrent branch of the lacrimal artery. So recurrent branch of the lacrimal artery. So to recap the middle cranial fossa, we saw the middle and accessory part of the accessory meningeal branches of the maxillary artery. Then we also saw the branch of the ascending pharyngeal artery. Then we saw the branches of the internal carotid artery and the recurrent branch of the lacrimal artery. Now moving ahead with the posterior cranial fossa. Posterior cranial fossa, there is a meningeal branch of the occipital artery. Next is the posterior meningeal branches of the vertebral artery. The posterior meningeal branches of the vertebral artery. The first one was the meningeal branches of the occipital artery. So you have the occipital artery, you have the vertebral artery. Next comes the dorsal. So there is the dorsal meningeal. So the dorsal meningeal as well as the tentorial arteries. Dorsal meningeal of the tentorial arteries. So these arise from the meningo-hypophyseal trunk. So meningo-hypophyseal trunk. So just let's recap. So we saw the PCF, that is a posterior cranial fossa. So here in PCF there is the meningeal branches of the occipital artery. Next we also saw the posterior meningeal branches of the vertebral artery. So we have the occipital artery, the vertebral artery. Then comes the dorsal meningeal as well as the tentorial arteries which arises from the meningo-hypophyseal trunk. Thanks for watching. So in case you haven't subscribed, please do subscribe to learn and grow daily. And this is a special thank you note to all the subscribers of this channel. And we have a 30+ playlist subject wise and it is in the description.